Hello, my name is Dr. Doreste with the Cranial Release Technique, and I want to spend a few minutes with you just discussing what the cranial release is, how it can help you and your own health, and also how it can help the health of your patients and therefore help you in practice. You know, it was about 100 years ago when William Sutherland, an osteopath, questioned why nature would create the cranium to have 22 separate bones as opposed to one solid bone. He went back into the anatomy texts at the time, of which there were no answers to that, and about 3 months later in his own writing, he talks about how he came up with the concept that because these 22 cranial bones never fused together, those bones must allow for movement. He started to use his newfound concepts of restoring the movement of the cranium to friends and family, and lo and behold, he had and created what you and I might call a waiting list type practice. People coming for all sorts of ailments, and by Dr. Sutherland just working on their head was changing physiology globally throughout the body. Well, fast forward to 2005, and I came along and created the cranial release technique, which is a 1-minute technique to align and restore the movement of the cranium and therefore enhance physiology globally throughout the body. Today at the convention, what we'll be doing with you is doing some very simple tests to determine if in fact your cranium is balanced or is it out of balance. If it's balanced, that's great. And if it's out of balance, we know what to do about that and how to fix that, and that's called the cranial release technique. Again, it's a 1-minute, very simple, very easy technique that's applied to patients from newborns to the elderly to enhance physiology at every level of who they are. Thank you so much for coming by the booth. We're going to get started with you in a moment, and then we'll talk in a few minutes. Thank you. Goodbye.